Hey, we're back. I'm your host, BKP, and we're at Circuit World here in Blue Ridge, Georgia, and it is time for Ask the Doc. We want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. Dr. Whaley, how are you today?
I'm great. Okay.
Yes. There's several flags from several countries on that tie today. So.
Okay. I wear my American flag tie all the time.
Yes,
I'm wearing this tie today because I have a lot of friends and patients that live in Europe. Yesterday, and of course it's been going on for 2 years, but yesterday there was a comment in one of the big European presses that Donald Trump is not popular in Europe. And you remember what his statement is about being not popular in Europe, right? I was elected to be popular in America and to stand for American values, and I'm not the least bit offended that I'm not popular in Europe. So now that everybody's chipping away at him in Europe, I figure I'd wear my tie saying he really doesn't care.
Okay.
And I don't care either. So he's not running for Europe, and he's not trying to be popular in Europe. And Macron's not popular either, and Merkel's not popular either. So.
Yeah, we don't. Our media does not share that with us or the people. But yes, they will comment that our president is not popular there, but they stop right there and they do not comment on how Angela Merkel and Macron and there's not a lot of big popularity.
All of our audience who likes this stuff, you can sign up for a daily briefing every day that comes from the U.S. I guess a lot of us get, but there's a European daily briefing, and I get that one. And so if you look at the European daily briefing every day, it begins today with Venezuela and immediately goes into Macron. But anyway, let's talk about soapboxes before we get on a soapbox. I'm going to stand on a soapbox in a little while. But you said
I have a
soapbox derby. Okay, I was a boy in Atlanta when soapbox derby was the biggest thing that happened in the springtime. And as I recall, you had to be 12 and under. You had to build your soapbox yourself, your derby yourself. It might have been 14, but if you had a learner's license for that age, you didn't. I'm pretty sure it was 12 and under. And then where Peachtree Street runs downhill from sort of like Piedmont Hospital down to Peachtree Creek was where that derby was held, and it was lined like the Peachtree Road Race. I mean, there were tens of thousands of people out there. And the Atlanta Journal-Constitution, which was 2 newspapers then, had all their photographers out there, and it would show up in the next paper the next day. And that was in the days before television, but WSB Radio did it live on the radio station. So the fact that we have one up here in Blue Ridge, I'm shocked, stunned, and amazed, but I'm anxious to see what that's all about. So,
well, we were talking about that earlier. So we will have a couple guys in here to talk about the Blue Ridge Soapbox Derby that's coming up, and I'm excited about that. Let's get to our first.
No, one more.
Okay, we got
the dumpster diving. I was telling Josh while you were talking, you're 2 days late if you were going to talk about them showing the federal employees at the food bank, which is a little different. Okay, because I thought you were going to go to the food bank, and the federal employee food bank pictures were out yesterday or day before yesterday. I haven't seen the dumpster diver one.
No, I say they're.
You said they were going to. But
I say they've got photographers assigned to watching closely to see if they can find something of that nature. That's what I feel the media.
Well, I think the food bank is about as close as they're going to get. But they had them 2 days ago. All right, so let's get to questions here.
All right, my husband is a chain smoker. Our first question today, my husband is a chain smoker and has rapidly lost weight over the last 6 months. He's 61. I also think he's getting pale and his appetite isn't very good. Could these be symptoms of lung cancer? It's been a long time since he's seen the inside of a doctor's office, and cancer has affected members of his family.
All right, here's what I'm going to tell you. I think he has lung cancer. But what I'd like to take and focus on here is what he should have been doing when he wasn't seeing the inside of a doctor's office. Since cancer's 7 dangerous signals, is weight loss and all the rest of that stuff. But this is a classic story of undiagnosed, relatively advanced lung cancer that could have been detected in a curable early stage. Josh, if you'll put up that picture there that's got those two lungs, I'm not going to make everybody try and read it, but the title, if you look at it, BKP, is Should I Be Screened for Lung Cancer? All right? Should I be screened for lung cancer? All right, first of all, if you look at all of these things here, you don't have to read it, but have you had 30 pack years? You remember that? 30 pack years. Okay, so 1 pack a day for 30 years, 2 packs a day for 15 years. If you listen to this, he's 61 years old and a chain smoker. He's got to be smoking 2 or more packs a day. So he would have been eligible to go get these tests I'm going to talk about in a few minutes 20 years ago. And 20 years ago, or 10 years ago, they might have detected something small, which we'll come to later, that would have been an early stage curable cancer of the lung. So what I'd like to focus on here, rather than the fact that this guy's probably got advanced lung cancer, is what should our population of people do out there? We have all these advertisements, even on Sean Hannity, that we've been blasting the vaping here with the teenagers. Right. And you'll notice now that there's tremendous television and radio advertising for the use of vaping as a substitute for people who have been longtime smokers. So the big tobacco companies have bought big hunks of the vaping business, and they're trying to get people to vape. So let's just make the assumption that this guy quit smoking 15 years ago. After he'd smoked he's 61, let's say he started when he was 20, that's 41 years, or he started when he was teens, it could be up to 50 years. Let's say he quit 20 years ago, and he's been vaping ever since. If you look at this, just that risk factor of having had 30 pack years would have made him eligible to start doing these screening tests, even if he'd stopped smoking. So that's the first thing I want to emphasize, is there is a huge population of people out there that smoked 30 pack years, and I've got a few other risk factors I'll come to in a minute, and aren't smokers now. You should continue to think lung cancer detection, and think about this very available low-dose spiral CT scan of the chest, which insurance and Medicare pays for. All right, Josh, show up that next picture there. Now, if you have any of these other risk factors, even if you don't get to the 30 pack years, if you got to 20 pack years, and you have some chronic lung disease, if you look at here, BKP, environmental and occupational exposure. Now that's where I'm going to stop, because I had a patient this week who used to work in the mines in Copper Hill. And he was he worked in the mines, he didn't work in the office. So he worked in the mines in Copper Hill, and he remembers that before they closed, the OSHA people came out there, and they gave them all these papers, and I think they might have even done some x-rays on them, I'm not sure, but told them that they had a risk of exposure to asbestos and other radon and other things that you get in mining. So if he had smoked 20 pack years and had worked in those mines in Copper Hill, well, I'm sure some of these people here that are watching today have been in that business. So if you got a friend or an uncle or your dad or whatever, he smoked for 20 years and he worked in those mines, tell him about this test. Okay, let's go to the next one, Josh. Why do you want to do this test? So all these people that we're talking about are totally asymptomatic. All they've got is the history of 30 pack years or 20 plus something else. Is that a pretty good sized number? 6,700 people? All right. So they have broken them in half. 3,000 don't get the study. 3,000 get the study. At the end of the day, you had 706 people out of that 3,000 that got the study that had abnormalities that were detected in that study. And let's see, what, 54, about almost 100 of those were early detected curable lung cancers. So our patient, I think, has cancer of the lung. I believe that if he'd been into this type of a surveillance program back years ago, that he could have detected this early. And we have a population of people in this audience that have smoked before and are not smoking now, that have worked in the mines and smoked and are not smoking now, plus the ones that are smoking now. So that's 3 different groups of people that ought to think about it. Now, you're going to turn right back around and say, well, I remember you telling us a few weeks ago you don't recommend the total body CT scans detect the disease they advertise on TV because it gets you in trouble with chasing things that don't amount to anything.
Right.
Remember that?
Right.
And they have complications. So here's the last one we're going to show. Josh, put up this one. This is a little hard to see. But what, in this spiral CT, these are only done by people who have the right machine, and they're read by people who are experts. This screening for $250 in the back of a truck in a parking lot doesn't fall into that category. So when they say you've got a spot on your lung there, they don't have any criteria to tell you what it might be and what you ought to do about it. If you look here, the criteria of the National Cancer Institute, if you've got a little tiny spot that's less than 4 millimeters, that's that big around, you don't do anything except do another scan in a year. Now, if you got one that's twice that big and less than a centimeter, you do one in 6 months. And as you get bigger, it tells you exactly what to do. And you have to get up to almost a centimeter before they start telling you to make any kind of intervention. So I am not against this at all. I don't think that this drives you down any path that's dangerous because you're chasing something that doesn't mean anything, because these criteria are very firmly applied to the interpretation of the test when it's read by the radiologist. So in my opinion, there is no danger to get this study. I've said repeatedly, I don't want you to go get this study with their advertising on the TV for $250 or whatever it is, but I would tell everybody, go get the low-dose CT scan if you meet any of those criteria that I had. And the person who asked this question here, at least send your husband to get the low-dose CT scan. I'm afraid I'm not going to like the outcome, but he needs to go get that scan. Is that enough?
Yes, thank you, Dr. Whaley. We appreciate your question today, and you can always send those questions to info, I-N-F-O, at fetchyournews.com. Put in the subject line, Ask the Doc, and we'll get it to Dr. Whaley. Again, we want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. Let's go to our second question of the day. I am nursing a 7-month-old baby. I suffer from horrible seasonal allergies, runny nose, congestion, and a slight cough caused by drainage. If I were, let's see here, if I were not nursing, I would take Sudafed or Benadryl and get some relief. I don't have any milk supply problems at the moment, and I don't want any. I need to know which medications won't decrease my milk output and won't transmit to my son. At this point, he shows no signs of allergies.
That's a great question, isn't it? I mean,
yeah, that is. I mean, there's a lot of concern I can thoroughly understand with this mother nursing her baby.
Yeah, I can too. It opens up 3 or 4 levels of questions. First one is, this is an intelligent mother. She knows that things that I'm doing are transmitted in my milk to my baby that can be harmful. Things that I do to myself might decrease my milk supply and be harmful. Dr. Whaley, what's your answer? Well, I've got good answers for you, but I would say you probably ought to ask your obstetrician or your pediatrician, because they will be able to hand you papers like you're getting ready to see. Let's put the first one up there, Josh. The specific question was about Sudafed or Benadryl and antihistamines. So if you just look at this first one, it's antihistamines. And this talks about during pregnancy. During pregnancy also applies to breastfeeding. So the common antihistamines are safe. Low risk means they're safe during pregnancy. But they should avoid during pregnancy and during breastfeeding the Sudafed or any decongestants. Now, you can take that one down, Josh, and we're going to just leave the next one off for just a minute. So you've got different kinds of cold pills. You've got ones that are just antihistamines, and Benadryl's the old one, chlortromatine's the old one, Claritin and those others are the new ones. And those are pure antihistamines, and those are considered low risk for pregnancy and breastfeeding. But when you get to the store and they say decongestant, and it's got Benadryl in big letters, or it's got Claritin in big letters, you got to be really careful. Decongestant means that it's got one of those things in it you can't use. So you got to be really careful that you're not getting a decongestant, you're getting only an antihistamine. All right, so that then opens up the question about what is safe really while I'm breastfeeding, or what is safe during my pregnancy that's commonly taken every day by everybody over the counter. Put that next one up about the safety of over-the-counter drugs. I'm not shocked, but if you look real carefully, Tylenol or acetaminophen, which is a non-narcotic, take it for fever, is safe during all sorts of pregnancy and during breastfeeding. But if you look at common drugs like aspirin, it tells you it's really not safe at any time during pregnancy. I mean, the risk A, B, C, and D, it goes to C, and D, aspirin does, during all of pregnancy, and you ought to avoid it. And then you got to, well, can I take ibuprofen or naproxen or something else like that? And then again, those are all B, C, and D during all of pregnancy. That's the same during breastfeeding. So in terms of I got a pain in my toes or a pain in my nose or I got a fever, you've only got one choice during pregnancy and breastfeeding, and that is Tylenol or acetaminophen. Now show that next big chart. This chart right here, I see all the time that patients get from their obstetrician when they are pregnant and their pediatrician when they are breastfeeding, and it is a pure breastfeeding list of what you can and can't take in terms of antihistamines and antibiotics and antidepressants. So many people are on antidepressants. Prozac's a very common antidepressant, and they say when you're breastfeeding, stay off of that one, but Zoloft and Paxil, which are equivalent, you can take. And then hormones, birth control and stuff, that's okay. St. John's wort and herbal supplements, no herbal supplements could be taken during pregnancy or during breastfeeding. So the question was specific about Sudafed and breastfeeding and milk production, but it opens up that whole can of what can I take while I'm pregnant that's common, taken, and everybody takes it, and what can I take when I'm breastfeeding? And the answer is, one, get that thing from your pediatrician or your obstetrician, and two, Tylenol is the only thing you ought to be taking for fever or aches and pains, and let the doctor tell you what's safe in terms of antibiotics. So well,
that was a very good question, and like you said, you know, there's genuine concern there when you're transferring, because you do transfer to your baby, and those are things that you should.
And that's what that big old chart says. Does it transfer? And the answer is yes. And it says if you're taking Benadryl, see if you made your baby sleepy. Benadryl is still safe. You know, they give babies Benadryl when they put them in a car, or they put them on an airplane on purpose, you know, to slow them down a little bit. So
give that baby behind me a Benadryl.
Yeah, right, exactly. Now that's not a joke. It used to be Paragaric. I mean, you may not be old enough to remember that grandmother would stick her finger in Paragaric and rub it on the gums of screaming babies and say they're teething. Well, they ain't teething. They were just trying to shut them up. So you remember Paragaric? Are you old enough to remember Paragaric?
Yes, I do.
You're not very old. Paragaric's been gone a long time.
Well, I don't know. I remember Grandma putting her finger in something and rubbing it on your gums.
That was Paragaric.
Okay, so no, right. I don't know what it was, but I remember it. Okay.
All right.
Always thank you, Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment. Dr. Whaley, at this time every week, what is some of the updates in the medical world out there?
Do I have it for you.
I figured you did. What do we have?
I got it for you.
What do you have? What do you have?
What do you have? That reminds me. That. Okay. Josh, you're going to be shocked here. This article appeared on January the 23rd in the British Medical Journal, and I know that you read the popular news about the British Medical Journal each week. January the 23rd, if I'm not mistaken, was Wednesday, wasn't it?
Mm-hmm.
One serving of fried chicken or fried fish per week increases the chances of death by 13 to 15% in women. And I want you to look at this number. This comes from what is called the Women's Health Study in Britain, and is 107,000 women. Is that a lot of women?
Mm-hmm.
107,000. Hey, Josh, is 107,000 women a pretty decent sample?
That's a big sample.
Now, they follow them for 34 years. 34 years. So here's 107,000 women being followed for 34 years, and they periodically will write about what they have learned about the things that influence their health. I believe that the authors were shocked, stunned, and amazed to discover that only one serving of fried chicken or fish increased your chances of death, cancer death and heart disease death. Then the people said, well, yeah, but people who eat fried foods, they're probably overweight. So maybe it's because they got overweight, and the overweight led to more heart disease. Well, statistically, they were able to, because they got a lot of women in that group who weren't eating one piece of fried fish, so they matched them against the people of the same weight. So they took weight out of it. So obesity came out of it. They were able to get alcohol and other habits out of it. So if they corrected for all of the other confounding features and kept it down to just the fried fish, just fried foods basically, because French fries actually went in there too, then it increased a measurable percent. 12 or 15% is a pretty good sized number for heart disease. 12 or 15% for cancer, then that's 30% added together. Now, there's been a big old study that was done in Spain that didn't show the same thing. Why is that?
I don't know.
Why, if we got Rick over there, he's supposed to know everything.
Okay, Rick.
All right, Rick.
Answer this question.
Answer this question. If the fried foods in England cause women to die and the fried foods in Spain didn't, what's the difference?
Oil.
Spanish cook their foods in olive oil. See, Rick knows everything.
Wow.
So it is thought that...
Was that a $300 question or a $200?
I sent him a text message last night.
Yeah, I think you just slipped him the answer.
I sent him an answer.
But the oil.
It's the oil. It's the olive oil. So we don't do it in olive oil in this country. So the British study will apply to us. Okay, I got two more quick ones here. I tell you, we'll have to get off. We got all this. Where's the soapbox derby? Where's the soapbox? Where's the dirt? Where's the box?
We were told 8:45.
Okay, well, I got to see that racer. I was telling them that it was a big deal in Atlanta in my day. All right, now, there is a huge, come on, Rick. Wait a minute, Rick. You got to be the foil here. There's a big measles outbreak in an area that's the hotbed of don't take immunizations. Where would that be in the United States?
Pacific Northwest.
Washington County, Oregon.
What is this, a trivia show? What happened here?
So that gets both. It's Washington County, Oregon.
We won't be able to do nothing with him the rest of the day. He's got two answers.
The guy's
now.
so smart, it's not even funny. So it's Washington County, Oregon, has got a really severe outbreak of measles now, and that is the absolute center of the hysteria about don't immunize your kids. And it occurs in two groups of people. Who does it occur in? It occurs in these kids that are in school that didn't get immunized, and it occurs in their grandparents, like us, grandparents, because our measles immunity is falling because our antibodies are falling. So It's one more time when I say get your flu shot and get your other shots, and all you people say I don't believe in getting shots, and my wife says they put mercury in there and causes autism. It's BS. Go get your darn shot. You want to hear one more?
Sure.
You want to prevent prostate cancer?
Sure.
You want to prevent prostate cancer?
Do we have another question for Rick? Do we have another question from the audience?
Well, I don't think Rick will have this answer.
All right.
About 15 years ago, there's a drug that's now generic called Proscar. And it got to be a real popular drug because that's the drug that young people like we have over here with Rick were taking to make their hair grow, when they begin to get early baldness. And that drug has an effect to decrease your nighttime urinations and to decrease the size of your prostate. And so they noted over time that the people who were taking it for their hair had less in the way of prostate problems, so they began to give it to prostate people. And there was a fear that since it made the prostate smaller and it lowered the PSA, that it might increase the prostate cancers that were of high grade and serious. So anyway, the final analysis is out now in hundreds of thousands of patients that it actually dramatically cuts the incidence of prostate cancer and does not increase the incidence of high grade prostate cancer. And that came out yesterday, and I guarantee you that there's going to be a run on the drug, but it's not going to be like the Shingrix shot where you can go buy the stock in the company that makes it because it's already generic. But that's a very important thing. So if you have a family history of prostate cancer, if you're a black male, there's a lot of risk factors, or if your PSA is relatively high and you're in your 40s and 50s, that drug should be given.
Dr. Whaley, I appreciate you very much. Folks, don't forget, if you'd ever like to watch these segments over or send them to your friends or family that may be interested in the same questions we had this morning, you can always go to FYN TV Fetch Your News YouTube channel. FYN TV Fetch Your News YouTube channel. Hit the playlist, and on the playlist you'll find Ask the Doc, and you can watch these again and share them with your family and friends. Also, if you have a question for Dr. Whaley, send that to info, I-N-F-O, at fetchyournews.com. Put in the subject line, Ask the Doc. And again, we want to thank Georgia Cancer Specialists affiliated with Northside Hospital for this segment. Dr. Whaley, if you hang out a minute right after this commercial,
I'm off my soapbox.
We're gonna have
vaccinations. We
got a couple guys coming in here going to be talking about the Blue Ridge Soapbox Derby right on the other side of these commercials. Take us to break, Josh.